So that is the question that's been asked around thoracic oncology clinics for a long time. The original design of many immunotherapy-based protocols mandated the use of the immunotherapy drug for about 2 years. That number was not based on any sort of scientific or clinical data. It was just felt that that was an appropriate time, at least at the time of starting the protocols. This then has evolved into a situation where some of our patients have really good responses to these immunotherapy drugs. And the question is being asked if for those patients who have had a very, very good response and there's no evidence of disease progression, do we really need to continue the immunotherapy beyond 2 years? Then there are patients who have had what we consider to be a partial response, at least based on CT imaging. And again, the same question is being asked: if the images have been stable without evidence of progression, do we really need to continue the immunotherapy? We do not have good clinical level data to settle this argument. So what is happening at this point is that we are having individual discussions with our patients in various clinics. In general, when I talk to my colleagues, many of them sort of favor following the available data and stopping the immunotherapy drug at 2 years. But some of my colleagues obviously do not feel that we can stop because we don't have the data. And I've argued that we should continue the immunotherapy beyond 2 years. So when I debated this with my colleague, Dr. Rodriguez at the TTLC, we sort of took opposite ends. We used the same clinical data, but my argument was, A, we don't have any evidence that treating beyond 2 years is going to be effective. B, we don't know if there could be additional toxicities beyond 2 years. And that C, until we have some sort of a randomized study telling us whether we should stop or not stop, we are going to be left without a proper answer to this particular question. So unfortunately for the audience, we won't be able to have a clear answer. We just have to say that's a decision between the physician and the patient. They should have the discussions, lay out all the rationale and the arguments that you have heard, and sort of decide how you want to proceed from there. And I think there are some investigators that are actually working on hopefully a randomized trial that will try to address this question, but that's several years down the road. So this remains a debate in all of our clinics.